Up next, we have Dr. Andaz and Gary Smith. Today, we're going to be talking about lung cancer and preventing it and also helping to cure it. With us now is the wonderful surgeon, Dr. Andaz. Welcome to the show. How are
Thank
you?
you. Thank you.
Good. I was so delighted to meet you. We were able to dine and have dinner together, and I got to learn about your passion. Tell us a little bit about your background as a thoracic surgeon and why lung cancer is something you want to battle.
So basically, as you know, lung cancer is the leading cause of cancer-related deaths in this country. I mean, if you look at the incidence of lung cancer, breast cancer is very common amongst women, prostate cancer for men. But the leading cause of cancer death is not breast cancer and it's not prostate cancer. It's actually lung cancer. And lung cancer kills more men and women in this country than colon cancer and prostate cancer and breast cancer combined together. And very little has been done over the years to reduce the risk of dying from lung cancer until more recently when the data came out to suggest that you should get screened for lung cancer.
A lot of times, you know, even growing up, people just thought, well, if I don't smoke, I'm not going to get lung cancer. But that's not the case.
No, so 90% of lung cancer is caused by smoking, but 10% is not related to smoking. We are seeing a lot more of these, people are saying maybe it's second-hand smoke or third-hand smoke nowadays, but most of the cause of lung cancer is definitely related to smoking and exposure to asbestos. So if you've been exposed to asbestos, you have a higher chance of getting lung cancer.
And I know asbestos and what is it, mesothelioma?
Yeah, it causes mesothelioma of the pleural
Okay.
space.
Okay.
It's a deadly disease. Yeah.
It is.
12 months, 18 months, and you're gone. Yeah.
And Mr. Smith, I would like to talk to you and thank you very much for sharing with us your personal story. Can you talk to us a little bit about your lungs?
Yes, my father had died of lung cancer. He was a smoker. He was 47. My older brother was 59, died of lung cancer. My younger brother was 51, died of lung cancer. I'm number 2 out of 4. I stopped smoking 20-something years ago, but after my brothers passed, I decided to get as much early detection as possible, and I found the program at South Nassau Hospital, thank God. And after about 6 years of following me, Dr. Andaz said one day, he said, the little tumor we've been following, nodule, whatever the term is, has grown and it's starting to look ugly.
Right.
And then we decided to, I'd sleep better with it out no matter what it is. So we decided to have surgery.
Excellent. And how was your experience working with Dr. Andaz?
Oh,
I hope obviously good, right?
It could not have been better. Because he did it by robot. I got a little scar about this big, no muscle, no bone broken at all. And it was, I was in and out of the hospital.
And not to embarrass you at all, but one of the things that most of his patients have said that I've talked to is the fact that he'll call you 24/7. Like at any moment you need him, he's there for you.
Yes.
So that was your experience
yes,
too?
yes. And his office staff is great too.
Yeah, Loretta, they're all great, right? So
Well, the advantage is that, when you talk about lung cancer and lung cancer that were originally detected on a chest x-ray, you're looking at big tumors, like 2 centimeters, 3 centimeter tumors. When you're doing a CAT scan, you're picking a cancer that's really small. So the original operation that we used to do was take the whole lobe out. But now,
your whole
lobe was
wow.
lobe would come out. Now
Okay.
with small cancers, 8 millimeters, 10 millimeters, like 10 millimeter cancers, 1 centimeter cancers, we don't need to take the whole lobe out. You can preserve your lung and just take a small portion of the lung and have, because you need lungs to breathe after all.
Yes, you do. And diagnostics, to diagnose this, you said that there's a new piece of equipment that could make a lot of lives be saved. What is
Well,
that?
it's the low dose CT screening for lung cancer. I mean, there's been this whole argument back and forth as to whether you should screen for lung cancer, you should not screen for lung cancer. And of course, the women, they said, they fought hard and they got the breast cancer detection. And the men fought hard and got the prostate cancer. But the poor smokers and ex-smokers were, many people actually stopped smoking 20, 25 years ago. And they're dying from lung cancer because nobody's screening the ex-smokers. And even the current smokers, when they get screened, they get scared. They see a nodule in the lung and they stop smoking because now, oh gosh, I got a nodule. Maybe this is a cancer. I said, yeah, it could be a cancer. You got to stop. And that actually persuades them to stop smoking also.
And what can we do as a media company bringing about awareness? What would be the most important message you would like for me to get out regarding this?
I think the message is, if you're a former smoker or an active smoker, if you're 50 years or more, you should go to your primary care doctor, okay, and ask them or request for a low-dose CAT scan for screening purposes.
Okay.
At South Massa, we have a screening protocol in place. We have a clinical research department, and we're enrolling patients who are former smokers or current smokers into the study. If you're interested, by all means, visit the website at southmassa.org, or you can call my research department at 516-632-3312 and ask for Evelyn and get enrolled in the study. We offer free CAT scans for people who are smokers, and we've saved a lot of lives.
Yes, you have. One of the things I wanted to ask you personally, though, is why did you go into this profession? What was the moment for you that you said, I really feel I want to help others?
It's a long story. It started up when I was a kid. You know, my background is I grew up in India, and you know, in India, a lot of poverty, a lot of poor people. So I couldn't see myself as an engineer. I could not see myself as I just want to be a doctor. I knew from the get-go. But I knew I wanted to be a surgeon. That was the key, because I like using my hands. I could not walk around with a stethoscope because I need to see results immediately.
Ah.
You know, as an internist or a medical doctor, you prescribe drugs and you wait for days and days to see results. I like to just get the bottom of it and be done with it.
Make the person better.
Exactly, fix the problem. And that's what I'm a patient. You got this spine in the lung. There's only one place it belongs. It's in the garbage. So let's take it out. Let's move ahead. And you know, I became a surgeon, and then I went to UCLA, trained in my lung cancer training at UCLA, and then came to Nassau County to help build the program at South Massa.
Well, we thank you very much for taking time out today. And Gary, is there anything you'd like to share with us, Mr. Smith?
Well, for anybody who's smoking, they're not being too smart. And if you have stopped within even 20, 30 years, look into the program. And I'm glad I did. I'm here.
Yeah, congratulations
right now.
and on your journey. Thank you very much for sharing it, your personal story. And as always, thank you, Dr. Andaz. It's a pleasure to know you. Please go get your lungs screened. If we can do anything with our television show in a little way by bringing about awareness and saving lives, it really matters to everybody. Thanks for watching Live It Up.